Ready, Dr. Patty.
Ready? Okay, thank you. Good morning and welcome board and online viewers to the June 4th Board of Health meeting. The board meeting is officially called at 8:01. This virtual meeting is being streamed via YouTube. And this offers the ability for people to comment, and also it serves a repository for the meetings that anyone can access later on. The meeting will be also rebroadcast on Facebook as well. The May Board of Health meetings minutes were distributed to the board for the review prior to this meeting. Are there any discussions or amendments to the minutes? If not, may I have a motion to approve the minutes as dispensed? Please raise your hand. Alana, do we have them?
Yes, ma'am.
All in favor? We have 6 people.
We have 7.
7, thank you. Motion's approved. May I have a second? Thank you. The motion is approved as dispensed. Thank you very much. Regarding the business and updates, with the regards of the ethics trainings that I've been mentioned for the last 2 meetings, for all the board and commission members, that we should complete, the Office of Metro Boards and Commissions for the Office of the Mayor informed that the board administrator that the information will be sent within the next 1 to 2 weeks to be completed. And remember, it'll be sent to both your personal and to your Metro Boards account. You just have to do it once. Please remember to open your Metro Boards email account often, at least once a month. And June is considered the Alzheimer's and Brain Awareness Month. And this has been supported by the Alzheimer's Association, who are encouraging all Americans to take charge of their brain health by challenging your mind, continuing learning, wearing helmets, physical activity, avoidance of tobacco, and control of the blood pressure. And we're still in the middle of a measles outbreak, particularly in the south part of the country. As of May 29, according to the CDC, there are 9,088 cases confirmed. These are the confirmed with positive identification of the virus. And this covers at least 33 different states, including Kentucky. The good news is that the only 2 cases that have been documented in our Commonwealth, they haven't caused any outbreak at all since they weren't surrounded by people that were already vaccinated. Texas Department of State has reported as of yesterday 4 new cases. They are now up to 742. So let's remember and remind everybody around us that vaccination is the best tool we have to prevent this disease. And if you're a parent, please go and talk to your pediatrician. We encourage all the vaccines that are essential to prevent any kind of serious infection disease. The interim dean for the School of Public Health with U of L, Dr. Kathy Van Gardner, has recurring meetings with U of L Provost, and this has conflicts with the schedule of the Board of Health meeting. And for this, we are welcoming today Dr. Tammy Thomas. She is the Associate Dean of Student Affairs. So welcome, Dr. Thomas.
Thank you.
And now we are going to start with our perspective sessions. The topic today is lead poisoning in Jefferson County, in Kentucky, Louisville's silent epidemic. The presenter is Dr. Brian Guinn, Assistant Professor and PhD Director at the University of Louisville School of Public Health and Information Sciences, Department of Epidemiology and Population Health. Dr. Guinn joined the Department of Epidemiology and Population Health in July 2020 after completing a postdoctoral training at the University of Louisville School of Public Health and Information Sciences. As a faculty member, Dr. Guinn teaches public health epidemiology to undergraduate and graduate students. His courses teach the theoretical and practical applications of fundamental epidemiological methods as well as the historical context that gave rise to modern epidemiology. His research interests include the association between environment-led exposure and human health and behavior, and this part is key. Dr. Guinn's current research plan includes assessing the association between prenatal blood lead levels and residential lead hazards. Today, I present to you Dr. Brian Guinn. Dr. Guinn, welcome. If you have your presentation, please share it, and you may do that at this time. I yield the floor to you.
Can you hear me? Yeah. Okay. Can you oh boy, I did not want to do that. Can you see my screen?
Yes, sir.
You can see that. Okay, great. Well, thank you so much for that warm introduction, and I appreciate you allowing me to be here. It's always a pleasure to discuss a great passion of mine, and that's environmental lead contamination and poisoning in Jefferson County. So I know there's some people here that maybe haven't heard this information before, so I appreciate you being here and affording me the opportunity to talk about this today. So I'm a lifelong Louisvillian. I've been here since the 1900s, since rotary telephones and the old Oregon Trail. My family's been here for hundreds of years. In fact, my grandfathers and great grandfathers built Schlüsselburg in Germantown. They were carpenters and cabinet makers. And this isn't just the city I live in, this is my home with a capital H. So I'm very passionate about the city of Louisville and especially about the health and wellness for our vulnerable populations. So Louisville, if you don't know, has an environmental problem. And I know this is true because I go out at least once a week with my research colleague, Dr. Charlie Zhang, who's a member of the Department of Geography and Geosciences at U of L. And we test abandoned properties, we test parks, we look at paint, we look at soil, and we send it off to a lab and evaluate the magnitude of lead contamination in Louisville. And we find lead contamination, uh, lead paint everywhere. And if you don't know this is what lead paint looks like, it typically has this alligator skin to it or this crocodile skin. I've never tested paint that looked like this that wasn't lead paint, especially if it's on a home that was built before 1950. So point me in any direction from where we are right now in downtown Louisville, and I will find you lead paint in just a couple blocks. That's almost guaranteed. So we really do live in a lead contaminated environment, and some of us live in a more lead contaminated environment than others. We just see it all the time. When you see homes that look like this, whether they're abandoned or not, rest assured there are lead hazards on that property. So it's just something that it's very common in Louisville, and really any older city that's east of the Mississippi River has the same issues. A year and a half ago, I took the Courier Journal out to, they were doing an expose on environmental lead issues in Jefferson County, and they wanted to see lead paint. And I took them to the California Park neighborhood, to this beautiful 3-story home that had been covered in lead paint. And I said, well, here you go. And they were taking pictures, and no, wait, I put my hand up on the side of the house, and I sprayed the house with a lead screening agent that turns pink or purple in the presence of lead. And I pulled my hand away, and it left a shadow here. And the point of this was to highlight how common lead hazards are in Jefferson County. What's not captured on this image is that when I turned my hand over, the chemical agent was reacting with dust on my hand, and the palm of my hand started to turn pink and purple. Even though I didn't have paint chips that were visible, the dust that had come off from this unstable lead paint was there, and I had lead all over my hands. So this home had bikes that kids had been riding. They were leaning up next to the house. It had basketballs and footballs that were obviously being used. That were leaning up against the side of this house. So it's in the neighborhood, and kids lived right next door on both sides. And this presents a major hazard, even if the properties the children reside in have been remediated and abated. When we have these abandoned properties, these older homes, lead hazards are still present, unfortunately. I got into the lead space during my dissertation. I took 100 lead core or topsoil core samples from around the city. and really just to look at the spatial distribution of lead contamination in the county. And what I found was uh, the northwest corner of the county, what we might call West Louisville, had 8 times more lead in the topsoil compared to the different southeast control area, which would be Fern Creek and J-Town. And the same thing was true for the parks. Louisville Metro Parks in West Louisville had 8 times more lead in the topsoil compared to Fern Creek and J-Town. When you map out the distribution, it looks like this in terms of topsoil lead contamination. And this was expected. When you look at the biomedical literature, we expect to see this. Where you have this older urban core of homes that were built before 1950, you find a preponderance of lead contamination. When you get out into the newer suburbs that were built later in time, there's just less opportunity for lead paint to be applied. There's less opportunities for streets to have existed during the lead gas era. So we find less lead contamination in the newer suburbs of Jefferson County. And that's found in all other cities. It's found in Cincinnati, St. Louis, Pittsburgh. Really everywhere they've done this type of research, we see this same distribution. I've also recently just finished up looked at abandoned properties, and I went to over 100 abandoned properties, and of course couldn't find all of them. Some of them had been torn down and they weren't easy to find, but other ones I could find. I went to 91, and 91% of those properties had topsoil lead contamination levels greater than the CDC threshold for safety. So 200 milligrams per kilogram is the threshold for safety for children in play areas, and 91% exceeded. 62% had topsoil lead levels greater than 1,000. This is correlated to a 5-point rise in blood lead levels in children that live on properties with that much lead contamination, and 10% had topsoil lead levels greater than 10,000. So a tremendous amount of lead in the topsoil. Why does the topsoil matter? Well, children play, and where they play, they might come into contact with lead directly. But also, if you're out cutting the grass or gardening, when you come in the house, you are tracking in trace amounts of soil with you. Even if you take off your shoes, you're tracking in trace amounts of soil. That soil will become a primary constituent of house dust. We sometimes don't think about house dust as being or having a soil base, but it absolutely does. So where there's lots of lead contamination in the topsoil, you should see a rise in the amount of lead in the house dust. So this isn't something that just stays outside, it doesn't come inside. It does come inside, and it can impact children that are inside of the home. 7 of the properties still had homes that we could access and evaluate the paint from, and 79% of those had lead paint easily accessible. You could just walk up and touch it. We didn't have to take down any siding, remove any plywood. It was just right there for the taking. 78% had levels that were twice acceptable threshold for how we define lead paint, and 57% had paint lead levels greater than 100,000 milligrams per kilogram. Essentially, remnant white Dutch boy paint that was applied in the 1930s was still on the surface and able to be obtained for half homes that we tested during this time. So again, thousands and thousands of homes in Louisville have lead paint on them somewhere. Some of them are worse than others, but that hazard is there. So we see this great disparity in Jefferson County between the oldest neighborhoods in the city versus the newest neighborhoods in the city when it comes to lead contamination. And what explains that? Most likely it's the distribution of pre-1950 housing. Certainly that's the number one risk factor for finding remnant lead paint. It's also the number one risk factor for finding lead exposed and poisoned children. So there is a very strong spatial correlation between pre-1950 housing and lead poisoned children in our community. It's not just housing where we find lead paint. Some of you might know where I'm going with this. Just over a year ago, I was eating my Cheerios at 6 in the morning, and I was reading the social media, and I saw this headline. I thought it was weird that they named a bakery Baked AF in a time of text messaging. I don't know why you name it AF. Maybe it's Abercrombie and Fitch. I don't know. But I was looking at the pictures, and I couldn't help but notice the interior side surfaces of this bakery. And if you look close enough, you start to recognize that this is old siding from the exterior parts of the building that they had brought inside and made the internal siding of this restaurant. This is absolutely lead-based paint, like 100%. I remember texting Nick Hart at 6:30 in the morning, and I'm like, bro, wake up. what is going on? And he called me an hour later and said, we're already on it. People complained and recognized what was happening. But it was just amazing to me that a restaurant owner and people that build homes or that manufacture homes uh, not think to maybe check whether this old white paint from the side of this pre-1950 structure was lead paint. But it was inside of a bakery and readily available to anyone walking in. So there's lead everywhere, and we don't often think about it the way we should. What does this mean for our children? Well, since or between 2005 and 2024, we've had 113,000 that have been tested for lead. 18,000 of those tests came back positive for elevated blood lead. When you remove the duplicate children the follow-up testing, there's 75,791 unique children. Of those 75,000 kids, 11,000 of them were found with a blood level greater than or equal to 3.5, the threshold for lead exposure or a positive lead test. When we look at the distribution for the age at first blood lead level, this is slightly older data that hadn't been updated. But the point is, when are kids being exposed? You see about half the kids are being exposed between 0 and 23 months of life, and then the other half are being exposed from 2 years of age and on. And really 12 and 20 months when most kids get tested uh, for lead in their blood. But we know kids are being exposed after 24 months, all the way up to beyond 5 years of life. So sometimes we pretend that after 24 months, we don't need to worry about it or screen for it. My wife's a pediatrician, her friends are pediatricians, and they really, from the conversations I've had, don't think about lead after 2 years of life. But really, we should be, because we know kids are being exposed. About 85% of the children had what we would call a normal blood lead test, although the CDC maintains that there's no safe amount of lead in the body. In the future, when the CDC lowers the threshold for what's considered normal, we'll see this drop, and we'll see the second number, 14.5, we'll see this rise. That's the percent of kids that had a positive blood lead test in our set in Louisville. So these aren't just numbers in an Excel sheet that we do statistics with. These are children that are being exposed to a known environmental neurotoxicant. If you don't know, lead mimics calcium in the body. Anywhere calcium can go, lead can go. Brain loves lead, or the brain loves calcium. So lead can cross the blood-brain barrier, get inside the neuronal mitochondria and disrupt the calcium kinetics and literally destroy the neurons. And research has shown that the longer you're exposed to lead as a child, the level of lead you're exposed to as a child correlates to brain loss in your prefrontal cortex later in life in your adulthood. So, of course, your prefrontal cortex gives rise to things like executive functioning, your intelligence, your empathetic concern, your moral reasoning, all things we would like to preserve for ourselves as adults, but certainly things we would want to protect when it comes to our children. I don't know about you, but when I was a kid, I had zero say in where I lived and where I went. So these kids really can't protect themselves, and they're really at the mercy of the environment they live in. So remember, these are not just numbers. These are someone's child, someone's baby that's being exposed. When we look at the distribution of lead testing in Louisville for the addresses we have, it's a non-random distribution. We have this cluster in the northwest corner of the county, and when we look at the spatial scan statistics, taking into account the background population, we believe that kids that live in this circle have a 9-fold increased risk for lead poisoning or elevated blood lead test compared to kids who live outside of this circle. So from the Portland neighborhood to Shively, from Shawnee to Smoketown, this large area here where we have a preponderance of pre-1950 housing, that's where we find a disparity in childhood lead poisoning in Jefferson County. Of course, kids are being exposed elsewhere. Anytime you live in a house built before 1950, you're at a much higher increased risk for lead exposure than if you were living in a house built in 1990. So we still find kids with elevated blood lead tests all over the county. It's just that the majority of them, more than half of them, live in this northwest corner of the county. And when you zoom in on the map, you start to see streets like Bank Street and Elliott Avenue, where every other house has had a kid with an elevated blood lead test in the last 15 years. And you start to wonder, what would this look like if we had data going back to 1980, right? You get a sense that like 100,000 kids or more maybe had an elevated blood lead test at some point in their lives. So It's still an issue we're dealing with today and will continue to deal with until the properties have been properly remediated or abated. So the question is, has Louisville been proactive at preventing childhood lead poisoning? And to some extent, yes, we do the best we can with what we have. But in terms of the absent literature, the questions we could be asking and answering, the policies we could be striving for, and I'm part of this. No, I've been doing enough to address this issue. And certainly, we have some NGOs that are now talking about things we can do to get out in front of this issue. So there are things we can do to address this issue beyond the rental registry and things we've tried previously. Now, a couple of years ago, I worked with Cassie Armstrong. Members of LMPHW came together and worked with Cassie Armstrong to think about how we can address this issue and looked at registered rental properties as being businesses that could be regulated, and we could require them to have a lead test if they're built before 1972 or something, and get a clean bill of health before you can rent there. Just as we would regulate a restaurant, we would regulate rental properties. And why would we want to do that? Well, kids that live in rental properties oftentimes live in older housing stock that has lead hazards present. And we see multiple kids from the same family living in rental properties being lead poisoned. We see multiple families living in the same rental property over time also being lead poisoned. Here's an example of three children, all of them having really high blood levels over time and then falling off surveillance, never to be heard from again. I don't think anyone knows what happened to this family other than the literature suggests they endured perhaps a geochemical brain injury or injury to their kidneys that might impact them later in life. To me, this is what tragedy looks like. I don't know what these kids look like. I don't know what their health looks like, but just from a biomedical literature perspective, that's what tragedy looks like. And it's not just kids in West Louisville. This was a child in the Highlands. The kid lives in a $400,000 house, found with a blood lead test of 70, and it stayed elevated for a number of years before falling off surveillance. This child was 5 years old when this blood lead test was first identified or first found, or they first did the test. So again, it's not just 12 and 24 months. We know kids are being exposed later than 24 months. So we went to Metro Council. Oh, there's Nick Hart. And we had this ordinance. And it required registered rental properties built before 78 to have a lead risk assessment. And this was universally passed by every member of Metro Council. And then right when it went into effect, the state got involved and threatened to pass a state law that would make it illegal to have rental registries for the purposes of assessing the safety of the rental unit, including that of lead hazards within the rental unit. So this forced Metro Council to come back and revise the ordinance or change the ordinance entirely. And now we're doing something slightly different that has some pros, but also has some cons. And to some extent still relies on kids to be the lead screening agent to do some sort of lead risk assessment on the property. So, one step forward, one step back. It's better than nothing, but the new ordinance, you might argue, wasn't as robust as the prior ordinance. So that's fine. It is what it is. We're going to do what we can. When all of that was going on, of course, there was this background research project with March of Dimes and the health centers and LMPHW and Metro United Way, where we were testing prenatal blood lead tests at the first prenatal visit. And what we found is something like 12% of the population had a blood lead test greater than 1.0, which is the average blood lead level for an adult in the United States. So we know pregnant people have more lead in their blood than they should be. At least 12 or 10% of them do. And why is that? We don't really know. We don't know if these pregnant folks are coming in and immigrating to the United States with an elevated blood lead level. Perhaps they're exposed to cookware in Haiti, or perhaps these are Louisvillians that have lived here their whole lives that are remodeling their home now that they're expecting and are exposing themselves that way. There's other, I guess, metabolic, biologic pathways that might explain why their lead is in their blood. But we really don't know why that is. We just know kids are being exposed prenatally. The placenta does a great job of filtering the blood, but it can't stop lead from crossing over into the embryo or fetus or the baby and exposing them before they're even born. So we have an opportunity here to think about lead screening not as a 12 and 24-month thing, but as something we do prenatally. So perhaps we can rethink surveillance and really look at what ACOG does or how they think about lead exposure. The CDC and ACOG do not currently recommend universal blood lead screening for pregnant people, even if they live in high risk zip codes for pre 1950 housing. So essentially, screening is never done prenatally, and any blood lead level for a pregnant person that's less than 5 is really ignored. So, that perspective leads me to believe they're viewing prenatal lead testing an adult lead exposure problem and not an embryonic or fetal development problem, which is interesting. When you look at CLIP, of course, if you live in a high risk zip code or you're on Medicaid, we're going to do screening at 12 and 24 months. Blood levels greater than 3.5 are considered high. And of course, there's tremendous variability by healthcare providers and health departments throughout the country. But when you look at ACOG and CLIP, you see that you have an opportunity here to join these two groups in their policies around lead screening and create a universal lead screening program that starts prenatally and extends through, say, the first 5 years of life. So, how can we get there? One thing I would like to do is continue on with the lead screening we're doing at family health centers, and I'm going to apply for a lead technical studies grant through HUD if the money's actually available this year, and evaluate whether elevated blood lead levels prenatally can reasonably predict environmental lead hazard at the residential unit. And if so, can we get out in front of this and start remediating and abating and protecting the child before they're born so that they'll be exposed later in life? An adult person is not down on the ground licking their hands and licking the floorboards. So if a pregnant person's blood level is 2, you might think, well, that's not that high, but that could represent an environmental hazard that will be disastrous for a 24-month-old that's now licking the floorboard. So we maybe need to rethink how we evaluate lead hazards in the medical community. So that's what I'd like to do. I would to use that
Dr. Guinn, you
research.
have 2 minutes to conclude, please. Thank you.
Yeah, I'm going to do it. I would like to use that research to create a universal lead screening protocol that would marry ACOG and CLIP and really think about lead screening as something that happens from inception through 5 years of life. Okay, so in summary, thousands of homes are found with elevated or are found with remnant lead either in or the soil. More than 10,000 kids have been found with an elevated blood lead test since 2005. At least 2 members of the Kentucky State Legislature are hostile toward our democratic processes in Jefferson County when it comes to lead. I think there's an opportunity to close the loop between prenatal care and pediatric care. And then we need to ask these questions and evaluate. Is there a prenatal blood lead level that reasonably predicts environmental lead hazards? And should ACOG and CLIP form a universal blood lead surveillance protocol? I think the answers to both of those are potentially yes. And that's what U of L and PHW and Family Health Centers intends to answer in the near future. So that's all I got for you. Thank you for allowing me to be here and talk to you about this. I'm sorry I went over a couple minutes. Where is the internet? I'll
Thank
stop
you
sharing
very
my screen
much.
and answer. Yeah.
Thank you, Dr. Guinn. Do we have any questions or comments from the board? This is such an interesting topic and a very challenging one for the whole community. Yes, Dr. Randy.
Yes, I was wondering, I had a couple questions. How long, great presentation, by the way, Brian. How long does the lead level take to decrease typically?
That's a good question. I think it depends on the dose you've been exposed to. I don't know exactly, and also the diet, how much calcium you're taking in. So it's dependent on your diet, your dose. There's other factors there. If you're continually exposed at low levels, I think all those play a role. That said, I can't tell you exactly if you take the child out of that environment, put them in a vacuum with a perfect diet. I don't know how long it takes. I do know that it takes more than a couple weeks usually.
Okay, and then are there any, and I'm not saying easily, but just kind of common sense ways that you can abate the problem of lead paint? Can it be simply painted over with modern paint, or is it something where you have to have, I don't know, have a lead abatement company come in? I mean, I could understand the problems with some of this stuff. Do they have any recommended ways that would be easily accessible for the average person to take care of this problem if they discovered it?
Yeah, so if your child is exposed to lead at a high enough level, there's opportunities to take part in Lead Safe Louisville and some funds there to remediate the property. The problem is for the average homeowner, say you're planning on getting pregnant and you find out the wood paneling on the side of your house is all lead, potentially the abatement or remediation process costs as much as your house is worth.
Right,
So
right.
it really is a challenge. I think covering it up with latex paint is a short-term solution. If you put latex paint on the front of your, your east-facing door, that's only got a lifespan of, so many years before it starts to break down. So covering up with latex paint is a short-term solution. Using aluminum siding to cover everything up is maybe a longer-term solution. There are companies you can contact, but it's going to be very expensive to do that. So it's a huge issue that's with a huge economic cost. Whether we do it or don't do it, we're going to pay for it either through dialysis in the future or the upfront costs of remediation.
Thank you. Dr. Guinn, can you stop sharing your screen, please? Does
Oh,
anybody else has? No, it's still, we're still
sorry.
viewing your, no worries.
Sorry.
Thank you
Is
so
that
much.
better?
Yes. Anybody else?
Yes, I have a question.
Yes, go
I
ahead.
heard you mention concerns with metro parks. And I didn't know if in your soil testing, if you have a list of perhaps which parks had the highest levels found. In addition, what are the remediation efforts for those parks? Like, I don't, as someone who works with parks, I don't know what to do with that information.
Yeah, great question. Just because there's 8 times more lead doesn't necessarily mean it's at a hazardous level. I can get you that information. I will tell you now, we're testing all the metro parks right now. Me and Charlie Zhang, we're testing all of them for all of the heavy metals. We have funding to do that. And I'll be very happy, is it Nicole George, to
Yes,
share our
Deputy
findings
Mayor.
with you. Yeah, sorry. Yes, I apologize. I'll be very happy to forward that information to you when we get it. If we find hazardous levels of lead, I think the only thing you can do is cover it in topsoil and plant grass seed on top of that. That seems to be the best path forward. But again, parks are huge. Some of these parks are huge. And if you're only taking 1 or 2 core samples here and there, does that necessarily reflect the actual hazard? Maybe it's an overestimation or an underestimation.
Are you taking
So
samples near playgrounds or where we already
yes.
see, so sampling near splash pads, playgrounds, where we see
Mhm.
kids under 5?
Yes, that's where we are
Okay.
sampling. And I can get you the information I have so far and share with you the information that we'll have in the next month or 2.
Thank you.
Mhm.
Anybody else? Any other questions? And working with public health and health promotion and disease prevention, even though this may be a small fixes just to promote the importance of for the kids to wash their hands after playing when they are coming inside, the not use of shoes when in the outdoor shoes inside the house, the dusting and the intentional cleaning, particularly for the spaces where small kids are. But of course, we need a bigger remediation, considering that adults are also exposed to this, and women who are becoming moms are also exposed to this. And we know we're thinking about kids, but adults also have disease secondary to high exposure levels of lead. And as you said, Dr. Guinn, the damage in kidneys and the damage in brain, even as adults, being exposed to this is important. So we are looking forward to more strategies to prevent and to reduce the huge impact of this big trouble that we have in front of us. Thank you. Anybody else? With this, we are certainly very, very thankful for this presentation, beautiful and really impactful presentation. Thank you so much.
Thank you. Bye-bye.
Bye-bye. We will continue our agenda and allow time and space for the updates and reports for the Mayor's Office update. And now I yield the floor to Deputy Mayor Nicole George.
Thank you, Chair. The only update I have that I think is worth noting is, and I trust my colleagues from the Health Department will be able to chime in. We are really doing a lot of concentrated work around enforcement of tobacco licenses. Everyone in this meeting understands the importance. They understand the ordinance that was changed in 2020. Ongoing efforts to really refine outreach to businesses, to do quality assurance checks, and to bring businesses into compliance. And so Mayor Greenberg is devoting a lot of energy and interest into ensuring that we are rolling out in a consistent way. And just want to give a big thanks to our Health Department colleagues and the County Attorney's Office. Thank you.
Thank you very much, Deputy Mayor George, for the update. And on the director's update, now I yield the floor to Stacy Ingram, Director of Louisville Metropolitan Health and Wellness Health Services, who will be giving the director's report for our Chief Health Strategist, Connie Mendel, and our Executive Director, Dr. Inder Singhal. The floor is yours, Ms. Ingram.
Thank you. Just a couple updates. We are currently accepting internship applications now through June 13th. If that's of interest to anyone that you might want to share with, the Gray Street Farmers Market will start this Thursday and go through the end of September. They continue their matching program for SNAP benefits. So this is a good opportunity for folks to get more with their SNAP dollars if they visit the farmers market. And we have a newly appointed Chief of Staff, Jennifer Bowman, who has been a longtime maternal child health administrator for the department, will now be serving in the Chief of Staff role. And there's additional details on those items in the report. Thank you.
Thank you very much. Anybody has questions for Ms. Ingram? We appreciate it. And now I yield the floor to Dr. Bart Irwin for Family Health Center. Dr. Irwin? I don't see him here today. We're going to go for healthcare coverage and outreach, and we are welcoming back Ms. Ashley Shoemaker, returning from maternity leave, and we are also thankful for Ms. Doris Furman for filling in while she was away. Now I yield the floor to you, Ms. Shoemaker.
Thank you. Yes. So our next coalition meeting is on Monday, June 9th at 4 p.m. We will be discussing Medicaid renewals for children, which are starting up again. So during the COVID public health emergency, renewals for children were put on pause, and their coverage was automatically extended year after year. So those will be starting back again next month. We want to encourage families to make sure that their contact information is updated with the state. When they receive the renewal notice, respond to it immediately. And if they have any questions or problems, to reach out to a connector for assistance. I also do want to mention the budget reconciliation bill that has been passed by the House of Representatives and is currently with the Senate. This bill would include over $700 billion in cuts to Medicaid and implement Medicaid work requirements at the federal level. What we've seen in other states like Arkansas and Georgia is that most people on Medicaid are working, and so these are really work reporting requirements more so than actual work requirements. And what we've seen is that people lose coverage as a result of these requirements because they're not able to keep up with the continuous requests to submit proof that they're working, and just those administrative barriers. It is estimated that in Jefferson County, about 27,000 people would lose Medicaid coverage because of these work requirements. That's about an 11% decrease in Medicaid enrollment in Jefferson County. Want to encourage everyone to, if you or a family member is enrolled in Medicaid, or if you are a provider who serves Medicaid patients, to consider contacting your senators, Rand Paul and Mitch McConnell, and let them know how Medicaid has benefited you.
Thank you very much for the update, Ms. Shoemaker. Does anybody has questions for Ms. Shoemaker? Thank you. The Immunizations Advocacy Committee is trying to find a goal and developing a plan to do the best job we can. I'm part of that too. So we won't have any update this time. I don't see a representative from JCPS. And for the Greater Louisville Medical Society, I want to say thank you to Dr. Anita Bhatia for her participation at the meetings for the last year. Dr. Jeffrey Goldberg will be the incoming vice president and will replace Dr. Bhatia as the Greater Louisville Medical Society representative for the Louisville Metro Board of Health meeting. He'll join us next meeting. Ms. Manson, representing the Kentucky Nurses Association, doesn't have anything to update for us. And we don't have a representative for Greater Louisville. Is there any other old businesses? Any new businesses? And if not, we are gonna, we're gonna adjourn our meeting. Our next meeting will be virtual on July, I'm sorry, I got lost. Miss Orlana, is July 4th? No puede ser. It cannot be July 4th. It's gonna be July 2nd.
July 2nd.
Yes, July 2nd at 8 a.m. It's gonna be a virtual meeting. And if this is it for this meeting, thank you everyone for taking time to participate at this month's meeting. And the meeting is officially adjourned. Thank you so much, everybody.
Thank you.